In this series, we are here to help you clear your NMC CBT exam. Every alternate day, we'll present you with 20 multiple-choice questions and their answers to boost your knowledge and to supercharge your progress. We've got a weekly master video with a whopping 120 MCQs. Don't miss out on this opportunity to excel. Let's dive right in. Question 21. Approximately how many people in the UK are malnourished? Option A 1 million, Option B 3 million, Option C 5 million, Option D 7 million. The correct answer is B. Question 22. In a patient with hourly monitoring, when does a nurse formally document the monitoring? Option A. Every hour. Option B. When there are significant changes to the patient's condition. Option C. At the end of the shift. The correct answer is A. Question 23. Recommended preoperative fasting times are: Option A 2 to 4 hours, Option B 6 to 12 hours, Option C 12 to 14 hours. The correct answer is B. Question 24. People with blood group A are able to receive blood from the following: Option A Group A only, Option B Groups A, B, or B, Option C Groups A or O, Option D Groups A, B, or O. The correct answer is C. Question 25. What is meant by an advocate? Option A someone who develops opportunities for the patient. Option B someone who has the same beliefs as the patient. Option C someone who does something on behalf of the patient. Option D someone who has the same values as the patient. The correct answer is C. Question 26. Wound proliferation starts after: Option A 1 to 5 days, Option B 3 to 24 days, Option C 24 days. The correct answer is B. Question 27. What is the role of the NMC? Option A to regulate hospitals or other healthcare settings in the UK. Option B to regulate healthcare assistants. Option C to represent or campaign on behalf of nurses and midwives. Option D to regulate nurses and midwives in the UK to protect the public. The correct answer is A. Question 28. How many cups of fluid do we need every day to keep us well hydrated? Option A 1 to 2, Option B 2 to 4, Option C 4 to 6, Option D 6 to 8. The correct answer is D. Question 29. What is abduction? Option A, division of the body into front and back. Option B, movement of a body part towards the body's midline. Option C, division of the body into left and right. Option D, movement of a body part away from the body's midline. The correct answer is D. Question 30. The nurse is caring for a diabetic patient and when making rounds, notices that the patient is trembling and stating they are dizzy. The next action by the nurse would be: Option A, administer patient scheduled metformin. Option B, give the patient a glass of orange juice. Option C, check the patient's blood glucose. Option D, call the doctor. The correct answer is C. Question 31. What is clinical benchmarking? Option A, the practice of being humble enough to admit that someone else is better at something, and being wise enough to try to learn how to match and even surpass them at it. Option B, a systematic process in which current practice and care are compared to and amended to attain best practice and care. Option C, a system that provides a structured approach for realistic and supportive practice development. Option D, all of the above. The correct answer is D. Question 32. What is the purpose of the NMC code? Option A, it outlines specific tasks or clinical procedures. Option B, it ascertains in detail a nurse's or midwife's clinical expertise. Option C, it is a tool for educating prospective nurses and midwives. The correct answer is C. Question 33. What are the steps of the nursing process? Option A, assessing, diagnosing, planning, implementing, and evaluating. Option B, assessing, planning, implementing, evaluating, documenting. Option C, assessing, observing, diagnosing, planning, evaluating. Option D, assessing, reacting, implementing, planning, evaluation. The correct answer is A. Question 34. Who has the overall responsibility for the safe and appropriate management of controlled drugs within the clinical area? Option A, all registered nurses. Option B, the nurse in charge. Option C, the consultant. Option D, all staff. The correct answer is B. Question 35. A client experiences an episode of pulmonary edema because the nurse forgot to administer the morning dose of furosemide Lasix. Which legal element can the nurse be charged with? Option A, assault. Option B, slander. Option C, negligence. Option D, tort. The correct answer is C. Question 36. Which of the following oxygen masks is able to deliver between 60 to 90% of oxygen when delivered at a flow rate of 10 to 15 liters per min? Option A, simple semi-rigid plastic masks. Option B, nasal cannulas. Option C, Venturi high-flow mask. Option D, non-rebreathing masks. The correct answer is D. Question 37. You walk onto one of the bay on your ward and noticed a colleague wrongly using a hoist in transferring their patient. As a nurse, you will. Option A, let them continue with their work as you are not in charge of that bay. Option B, report the event to the unit manager. Option C, call the manual handling specialist nurse for training. Option D, inform the relatives of the mistake. The correct answer is B. Question 38. If you were asked to take standard precautions, what would you expect to be doing? Option A, wearing gloves, aprons, and masks when caring for someone in protective isolation. Option B, taking precautions when handling blood and high-risk body fluids, so as not to pass on any infection to the patient. Option C, using appropriate hand hygiene, wearing gloves and aprons where necessary. Disposing of used sharp instruments safely and providing care in a suitably clean environment to protect yourself and the patients. Option D, asking relatives to wash their hands when visiting patients in the clinical setting. The correct answer is C. Question 39. What fluid should ideally be used when irrigating eyes? Option A, sterile 0.9% sodium chloride. Option B, sterile water. Option C, chloramphenicol drops. Option D, tap water. The correct answer is B. Question 40. Barrier nursing for C.diff patients, what should you not do? Option A, use of hand gel alcohol rubs. Option B, use gloves. Option C, patient has his own set of washers. Option D, strict disinfection of PT.S room after isolation. The correct answer is A.